Hello, this is Dr. Vaishali and I'm reading from the book Substance of Homeopathy, book written by Dr. Rajan Sankaran, chapter number 13, Pathology and the Miasm. Earlier, we looked at how certain miasm are more common in particular age and how some pathology reflecting the different miasm are also more commonly seen in the different age. For example, measles in childhood and degeneration like Parkinsonism in old age. Similarly, the evolution of the disease will reflect the miasm. For example, with an inflammation of the lung, means pneumonitis, the first reaction is one of the severe pain, high fever, restlessness, quick pulse. This is the stage of the acute miasm and require drug like a aconite and a belladonna. If the condition does not spontaneously resolve at this stage, means progress depend on the intensity of the root. So the body mount an active inflammation response will exudate of a plasma protein like a fibrogen which cause consolidation of the portion of the lung. Now neutrophil attack to site by the chemotaxis and are unable by the fibrin scaffolding to engulf the organism. This is the subacute stage where the body has contained the inflammation but the threat is still present. This stage required drug like a rust toxicodendron and Brianna. The symptomology will call for this group. Following this, the body has to clear up the debris for complete resolution. This is the struggle. When this process is unduly delayed, SORA is active and drug like sulfur and lycopodium will require. Normally, the condition does not go beyond this. However, if the lung turn sequel such as restrictive pulmonary disease due to the fibrosis between pleural surface, imperfect resolution, etc. are found, it indicates the psychosis. Drug like silicia now needed. In some cases, the infection result in the lung abscess, indicating the syphilis. Here we find the drug like a hipersulf and the mercurius, often indicated. Depending on the intensity of the root, the person is carried through to the various stage of pathology described above. If the patient has a predominant psoric miasm, we will often see pathology corresponding to the state persisting. At the same time, we must remember that it is not the pathology which shows the miasm but the state. The pathology per se is not as important as what is characteristic of the pathology in that individual. This is usually in keeping with the mental and physical state. The three together reflect the miasm. The mental delusion or response and the physical type of reactions and response at physical level or the state have already been discussed. To understand what is the characteristic of pathology in that individual, let us take the example of an ulcer. We do not conclude from the pathology. Example, the ulcer, that the underlying miasm is syphilis. Consider the following. Acute ulcerations of the gastric mucosa often result following the severe burning like Curling's ulcer. This shows the acute miasm. Psoric ulcer would be one following the trauma in which there is a struggle to restore the normal skin. These ulcers are sensitive, painful and there is a healthy cannulation tissue but the process is slow. So it is a psoric. The psychotic ulcer will be indolent with proud flash means hypergranulations and often painlessness. And last one, syphilitic ulcer are spreading, unhealthy and destructive, offensive. Certain pathology fall into the particular miasm or the remedy state. For example, warts belongs to the psychotic state and call for the drug like a thuja. But if the person has a strong tendency to warts and if his state is in a stamonium, the stamonium state will also aggravate the warts, although the stamonium is not known for such a pathology. This can be understood by the example. If a gangster is well trained in smuggling, maybe because his basic nature is that of a smuggler, he will do his job very well now. Very well. Now, if he is in a country where there are a very strict custom and restriction and hence almost impossible to smuggle goods into, He may enter politics, but here too he works in the same manner. Example, with cunning and secrecy, uh, as he is still like he is still smuggling. A normal chronic problem, for example, hair loss, can in a particular case manifest with the acute expression. Stramonium may be the remedy provided there is a stramonium feeling and reaction to the hair loss, panic and crying for the help. We have to find what is the state that indicate the miasm rather than the finding the miasm on the basis of pathology. Some erroneous notions have risen from the lack of understanding of the concept. It has been mentioned in our literature quite correctly that psora does not usually cause structural changes. This must not be taken to imply that where there are structural changes, the case is not psoric. The same holds true for the acute miasm too. In such case, you are likely to find a strong genetic predisposition to that condition. I believe that miasm are inherited or acquired separately from the tendency to pathology. I further believe that the inheritance of the miasm is not genetic and actually take place because the vital force of the patient is tainted by such a state. Only such an explanation can account for any observation that the state of the father and mother at the time of conception are seen to be transmitted to the offspring. Finally, we must remember that the miasm are only a classification. What must be cured is the disease state.